My name is Matt Bannick, and I'm the managing partner of the Omidyar network. And the title of our panel today is Going Mobile, the good, the bad, and for a little drama, the unknown. And so today we'll be talking about the extent to which the rapid adoption of mobile around the world is creating opportunity to potentially transform the lives of millions in the developing world. And we have a fabulous panel to help us discuss the topics today. Starting from the far right here is Nick Hughes, who's the managing director of Signal Point Partners. Next to him is Peter Sa, who is the CEO of the Wholesale Applications Community. To his right is Erica Wyrick, who's the executive director of the Global Health Research Foundation. And right to my left here is Nathan Wyeth, who's the director of Frontline SMS Credit. Now, before we launch into the panel, I have just two slides to share with you that kind of will help frame our discussion for today. So, walk over here so I can see my own slides. This first slide just gives you a sense of how, oh, really, I'm hearing myself too much now. The first slide just gives you a sense of how rapidly mobile telephony has taken off around the world. And on the vertical axis there is the number of mobile phone subscriptions per 100 people. And on the horizontal axis, for those of you in the back, is 2000 to 2010. And that top line is the developed or rich world. And as you can see that essentially in the rich world, mobile is completely, is fully penetrated, fully adopted, as many of us can attest. That second line down shows the adoption in the developing world. And it really is quite astonishing. I mean, we know it anecdotally, we hear it, but the numbers there are quite stunning, in fact. So you've gone from, in 2005 to 2010, so just in the span of those 5 years, about 25 mobile phone subscriptions per 100 people to about 70 today. And you see the slope of that curve and the way it continues up. And I don't think it's far-fetched to say that within the next 3 to 5 years, mobile will pretty effectively be penetrated across the developing world. Now, the third line there is a bit of a cautionary tale. That is the line that shows the penetration in the least developed countries. And these obviously are the poorer countries and also frequently tend to be more rural environments where perhaps it doesn't yet pay to have the mobile infrastructure in place. So I think even as we're very excited about the potential for mobile telephony, I think it's important to recognize that there is a segment of the developing world that has actually fairly limited access to mobile. And in fact, if you look at the slope of that curve, it's actually flattening out a bit. So as we think about the opportunities in mobile, I think we should be conscious that there is a segment there that risks being left behind. Now, with the huge explosion of the adoption of mobile telephony, you've seen a similar explosion in mobile applications around the world. And this slide is really just to give you a sense of some of the applications. So for example, in the arena of mHealth, there are SMS treatment reminders that remind you to take your pills so that you stay on your treatment regimens. There are remote diagnostic applications that enable people remotely to understand what medical conditions one might have. On the agriculture front, you've got crop data, real-time weather information, and a plethora really of other applications that really help farmers make the most of their resources. On the right-hand side here, you have citizen activism. So it's not just about economics and agriculture. It's not just about health. There's a heady dose there of civic activism, enabling people, among other things, to hold their government to account. And then on the bottom here is mobile money. And to be honest, Omidyar Network, we actually invest in organizations across these and other applications. We're particularly excited about mobile money, not just because we have Nick Hughes here. I'm not just pandering to Nick in the comments here. But we think that mobile is an essential part of infrastructure that will unlock a lot of other really terrific mobile applications because it provides a payments infrastructure. And a payments infrastructure will just facilitate the growth of for-profit applications that have the potential for massive scale. So with that, because I promised only 2 slides, I want to turn it over to our panel. And starting with Nick, I will ask each panelist to say a little bit about their work and then mention to us the single most exciting development in the realm of mobile telephony and communication, and also the single biggest challenge they see as we try and make that mobile communications more relevant for the poor in the developing world. So, Nick, do you want to kick us off?
Yeah, sure. Thanks, Matt, and good morning, everybody. Signal Point is a new company. We're about 18 months old now. We've got 20 people in Nairobi and 10 in Mumbai. And we're focused on delivering mobile services in emerging markets. And these have to be essential services. They have to be scalable. They have to be consumer-facing. We're a for-profit company, a single bottom line. But because mobile is all about scale and about reaching hundreds of thousands of people in these emerging economies, by default, we know that the work we're doing has the potential for a very significant social impact. We've got 3 ventures underway at the moment. The one in India is a very simple health proposition. We've got a call centre. Our call centre is staffed by doctors. There's an oversupply of doctors in Mumbai. And we sell line call access out in rural parts of India into that call centre. So if you want primary healthcare advice, you get hold of one of our call line tickets and you just call in. It's a really simple proposition. Under the bonnet on that, there's lots of value actually in data and tracking patterns and booking appointments at clinics. But it's a really simple consumer proposition. The 2 we've got running in Kenya, one is a mobile savings product, which we've taken product design from a very clever guy called Stuart Rutherford, who was one of the editors on Portfolios of the Poor. And he's been looking for many years at how can you deliver financial services to people on low income, and we've taken some of his work and we're running it on top of M-Pesa in Kenya. And this is an entirely mobile-based savings proposition for people on low and very erratic income. And the third product, which I'm actually going to selfishly claim as my most exciting thing ahead of us, is a machine-to-machine proposition that we're working on. This is M2M, so embedded mobile technology. In sub-Saharan Africa, about 80% of people live off the electricity grid, and they spend between sort of 30 and 40 cents a day on kerosene. That doesn't need to happen anymore, and we've got an exciting project which can tackle that problem. We've taken solar panels, about a $100 unit solar panel. Now, if you try and sell a $100 unit to somebody on low income in sub-Saharan Africa, you might as well whistle in the wind. You can't sell a $100 item. But what we've done is embed some mobile technology in that panel. So that panel is now out there on the mobile network. We can see it, we can monitor it, we can turn it on, we can turn it off. And so the proposition is $5 down, and every time you turn that solar panel on, we collect a small payment from you. Really simple idea, and it's going to go way beyond just solar energy. It's going to go into water irrigation pumps, cattle fences, sewing machines, anything you can turn on or off with today's mobile technology, and you can embed smart mobile technology in it. You can start to use that to gather information and to collect payments. So that's my most exciting thing, and the biggest challenge? Well, for me, it's about scale. How do we prove scale in emerging markets around these mobile services? That's actually really difficult. We've got M-Pesa, which sort of stands out as one example, but we've got to see more proof points of scale. And that means a couple of things need to happen. We need the right investors to come to the table and say, look, we can see the opportunity and we're willing to take that early stage market risk. That's really important. We need the right people. We need people who can also see this vision but actually understand what products and services are relevant in these markets. This isn't about selling Angry Birds out to people on $5 a day. This is about thinking what essential services can be delivered over the mobile at a fair price and at low cost. So that's what Signal Point's busy on. I think we've got to see scale appear in the next couple of years to match the curves that Matt showed on the charts. The infrastructure's there, the handsets are there, and we now need to think about this service layer that we can deliver over that existing mobile network. Thanks.
Good afternoon. I'm Peter Sa. Just to clarify a bit of the CV, because of questions have been raised. With Vodafone, have been with Vodafone. So I actually know Nick since 2003. 2001. May 2001, sorry. On that side. Reformed kind of venture capitalist as well. And what I'm doing right now is working for this not-for-profit entity called the Wholesale Applications Community. So this is not a foundational side, but it's really an alliance of 72 members globally around that area. So read this as being, you've got ostensibly the #1 operator and the #2 operator within every market who's tied to this and helping fund this, as well as you have technology partners like Intel, Samsung, Qualcomm, Huawei, things of that nature, who are also members. And the thesis behind this is, one, there's a lot of fragmentation in the market as it pertains to these type of technologies. So if you write an application, whether it's for social good or commercial good, it's very, very difficult to do. And you've got n number of devices, n number of solutions. What's the technology used on the device side? And then how do you transport that information? And then how did you manage on the back side? So as Nick kind of talks about on the payments bit in those areas, if you write a payment solution in those areas, many times you have to write it for each operator in each country and each solution. So one of the things we're trying to do is provide common solutions on the device side and common solutions on the back end. So one of the things we announced is we'll have a common set of application protocol interfaces, or APIs. So if you want to tap into things like billing, authentication, voice, SMS, you write to one application. And then we'll abstract that and make that available. So regardless if you're trying to get to a Verizon, AT&T customer, China Mobile, China Telecom, China Unicom, Telefonica, Vodafone, we'll manage that for you in that process. So that's kind of what we're working on right now and developing those type of solutions. When you talk about kind of the opportunities and challenges, for me, they're kind of one and the same, right? So the opportunity, as Matt's kind of talked about, is the rapid proliferation of devices and move to a mobile side. I mean, I think it's absolutely fantastic as you've seen high computing powers that's going on to a device side, right? And the fast adoption of it. The problem with it is, again, to my earlier point, it's extremely fragmented overall, one. And two, they're great solutions for OECD markets, right? But for developing markets, it's not available. So part of the solution is, how do you innovate? And so I was teasing Nick a bit about in our early days. I remember when I was in corporate strategy at Vodafone. Nick came to my office talking about M-Pesa. Is this okay to say?
Yeah, sure.
All right.
Go ahead.
So
I got a thick skin now.
yeah. No. You know, it goes much to Nick's side. Is he was selling a solution. Ironically, what people don't know is M-Pesa was founded by the UK government.
Yeah,
It was not funded originally from Vodafone, although he was a Vodafone employee. And Nick, to his benefit, had to go around knocking on every door within Vodafone to get support for this notion. And now everyone here goes, well, this is brilliant, makes total sense, right? But I think not only do you have the technology barriers, but this notion of how do you get innovation, how do you fund that innovation? Again, whether it's for commercial good, for social good. I mean, I obviously represent the commercial side or the business side of that nature. But again, putting on my kind of former VC hat is that funding and being able to drive that is non-trivial overall. And working through what's a good idea and getting out there is a big challenge. But we're moving in great ways to make that possible. So.
Thank you.
It's an exciting company for me, actually. So I'm Erica Wyrick. I'm a physician, and I'm also on faculty at Stanford in family and community medicine, and actually in the Department of Engineering, helping with a class called Engineering for Good. And I actually came from a background of having experience on the ground, actually with the Aga Khan Health Service, among others, in far northern Pakistan, working in health development and really seeing what the feeling of the disease burden is like on the ground, seeing a baby die of neonatal tetanus or seeing somebody die of dehydration from diarrhea. And frankly, working to alleviate that in some way is relieving. So most of the work that I did abroad prior to Global Health Research Foundation was before residency. And when you're in medicine, they make you do a whole lot of training. I would have gotten out of it if I could. But after I emerged from that process and I had my first sabbatical, I wanted to go back to one of the programs that I'd worked in. And I looked back at all of the programs I'd worked in actually the National Health Service, a refugee health program in Pakistan, the Aga Khan Health Service, maternal and child health program, and in former Soviet Georgia, and all of the programs I had worked in had collapsed. So with the people that I'd met doing this kind of work and through my master's, which was in international development policy, we came together and began to think about, are there underpinnings of sustainability that can be provided to programs as tools? And can we come up with those and provide those instead of going back to these regions and just serving in a health capacity, putting a Band-Aid on a problem? And so that's what we began to look at. What are the underpinnings of sustainability, and are there tools that we can actually deliver to programs to increase the chance that they'll be sustained, or that the knowledge or health improvement that they're bringing will be sustained? And we came up with a number of things, but two of the things we thought we could assist with were assessments and outcomes. So how do you do assessments that really learn what the community feels about a problem, what's been tried and failed? How do you integrate community members in the decisions about what solutions you're going for, what are the outcomes you're going for, and then help them get the data that then generate those outcomes? And then outcomes. How do you get outcomes back rapidly? It takes a lot of time to clean and analyze data, but we realized that in my own practice, I'm able to pull up a list of all my kids who haven't gotten vaccinated, or all my patients whose blood pressure is too high. I can pull that up, and it turns out it's not in the electronic medical record, but rather an open source data warehouse that harvests from that. And so we could bring that kind of technology out and begin getting data back rapidly instead of the long cleaning and analysis process, and then assist programs in the business tools of data utilization. How do you then put that data into a dashboard where you can actually see where you are compared to where you want to be, and you can and go through a process of cleaning data so that you're actually getting the data back that you need. So most exciting for us has been our help with the Uganda Malaria Surveillance Program, which is UCSF and London School of Hygiene and Ugandan Ministry of Health and Makerere combined effort with 10 locally distributed clinics, where every patient who walks into the clinic is treated in the same way. If they have a fever, they get a slide to see if it's malaria. If they have a cough, they get a sputum to see if it's tuberculosis. And then there are other tests integrated too. They're asked the same questions. They can't leave without having their questionnaire stamped, so we know, do they have a bed net? What's their history? And then assisting in getting that data back in almost real time for the researchers so that they could identify where malaria is now instead of 2 years from now when seasons have changed, and then knowing where malaria and tuberculosis and other diseases are now, can we then target resources to where the disease is? So we discovered in that system, by dropping in the World Health Organization insecticide spraying schedule, that after WHO sprayed a region, there was no slide positive fever cases or no malaria for the following couple of months. So medications can be directed to other areas. Or we met Bernard Nolan, who's the head of the President's Malaria Initiative, which is the USAID. They have HIV and malaria divisions of the aid that's given out, and that's the malaria division. And he was in Kampala, and he told us that the U.S. gives $62 million a year to Uganda to make sure that every Ugandan gets a bed net. And we had just been out in the villages and told him that the only bed net we saw was somebody was fishing with it. So that's actually doubly bad, because then the insecticide is getting into the stream. So exciting to be able to find out what's working and what's not. Bed nets work great if they're actually being used. But if they're not making it out, we don't know why they're not, but we can guess. But we know that they're not, then other measures have to be taken. And so those are the process that we've implemented, and we're working in the Central Valley on asthma in Fresno, and in Bhutan with World Wildlife Fund and the Ministry of Health on tuberculosis, malaria, and maternal mortality and environmental issues. And then we're working with Uganda on malaria. The biggest challenge, we try not to work with we're we're agnostic, I should say, technology agnostic. So we try to work with what people already have on the ground, which includes things like epi-info sometimes, which nobody even answers the 1-800 number for, by the way, if anybody's here from the CDC, and other programs that they may have already purchased. And we try to create these systems which are very creatable with what they have, and then advise on what the best technology is if they don't have it. So the challenge is interoperability and scalability. What can we bring in that doesn't get us stuck in, or get our money stuck in places that we can't get it back? How can we be the most flexible and move up to the next higher technology? And so that's the biggest challenge.
Thank you, Eric.
Thank you. This is a really inspiring panel to be on. It's wonderful to be here and with the support of the Vodafone Americas Foundation and the great work they do here every year. Frontline SMS Credit builds software tools to enable enterprises and grassroots organizations to use mobile money and incorporate mobile payments into the good work they're doing. Mobile money, so accordingly, I would say that mobile money is the most exciting thing happening in mobile. It's practical, and I would also say it's very profound. And it's practical in the sense that it's what I and many other people in Nairobi use to pay for taxi rides. But it's also something that it can extend dignity and safety and security and new trust in institutions to people who have previously not had access to that. So Eric, to put, one way that I look at mobile money is in comparison to how Eric Schmidt of Google compared computers and cars. And he actually, he said at one point that the fact that computers were invented before cars is a bit of a bug and a fluke. And if computers had been invented before cars, we wouldn't drive cars, they'd be driven by computers. And in the same way, I think it's a bit of a fluke of history that people have been brought into a global economy and to the edge of markets and been exchanging their goods and services and their labor with an economy where billions of them have only had partial access or no access to the whole side of financial services that make it possible for us to interact and benefit from the global economy. And so I think mobile money corrects this, and there's no small element of justice in it. And the potential that we see in mobile money is to extend goods and services to people who have not had access to them better, faster, smarter, more cheaply. And this includes mobile banking and mobile financial services, microfinance, but I think it goes far beyond this. Nick was getting into some of the ways that mobile payments can be overlaid alongside other essential services. I'd like to kind of postulate a corollary to the second law of thermodynamics that we can use in international development, which is that alongside any delivery mechanism, there needs to be an equal and opposite or perhaps parallel payment delivery mechanism. And you can figure out how to keep a vaccine cold and get it all the way out to a remote village, but if you can't pay the truck driver efficiently to get it there, and if you can't pay the community health worker to deliver it, and potentially if you can't deliver an incentive to the patient or the mother of the recipient of the vaccine, it may not get there. And so what we hope to do is to bring the organizations that are doing such good work around the world and whose work could be enhanced with mobile payments onto these mobile payment platforms so the full benefits can be delivered to the poor. The biggest challenge that I see to the sector as a whole is that the operators of these payment platforms sometimes look at them as such, as platforms, and sometimes look at them as products. And I think with good reason, these are mobile network operators that excel at selling airtime, selling data, and in this case, selling money transfer services. And when they look at it as a product, they don't manage it with this platform potential in mind. And I'd like to suggest here that the way that we can make these, turn these into platforms that are far-reaching and reach their full potential is that we have to build them with these mobile network operators. We have to join them. We have to figure out how to ensure that these platforms reach the farthest villages, that the agent networks reach the farthest villages, and that it won't happen without the expertise of the organizations already working with the poor, and that Frontline SMS Credit hopes to be part of that process.
Good. Thank you, Nathan. Now, I'll go through and ask each of you a directed question, and sticking on sort of this mobile payments theme for just a moment. And I know, Nick, you're not one to rest on your laurels, and you're already obviously moving forward with new and exciting things, but I do think your name will, for some time, continue to be associated with the runaway success of M-Pesa, with which I think probably most people in this room are familiar. One of the stunning statistics is that I believe it is, depending upon who you listen to, I believe about 10% of GDP in Kenya now goes through the M-Pesa system, which is absolutely mind-boggling.
$200 million a day.
$200 million a day in a not so large economy.
20 transactions as well, $5 and $10 and $15. Yeah.
So huge success, and I suspect that not only is a success in terms of the volume that goes through the system, but also in terms of bringing benefits to millions. The question, though, is that an anomaly?
Yeah.
Right? It's absolutely taken off and been phenomenally successful in Kenya. There are some experiments in other markets with mobile money, but mobile money is not yet very widespread. And I was wondering if you could share with us why you think that is, and what are the obstacles that really need to be overcome?
Yeah, sure. No, it's a question that comes up a lot. But first of all, I just want to correct one thing. M-Pesa wasn't born of one person. I had a team of fantastic people who worked on this. I had a there was Arun Surin, a previous CEO, gave me air cover. I had a team of people who refused to lie down until we made this work. So whilst my name sticks to it, actually it's a whole bunch of people that got involved.
I'll be careful in subsequent discussions never to give you much credit, and so I'll be on safe ground.
Nick's humble about that, but again, being there next to Nick, saying it without him pounding on the door and getting the visibility of it, it would not have happened.
Look, you're talking to an introverted Brit who starts to feel very uncomfortable. But look, it's happened, and we haven't yet seen replication, and so that's a really good question. But let's just take a step back and think about what is happening, because it's only 4 years since we launched M-Pesa, and we weren't the first ones in the market actually with mobile money. The guys in the Philippines were doing this in 2002, Smart and Globe, which is now Gcash. A number of things happened in Kenya to make it work really well. I mean, the regulators let us get on with it. In fact, they sort of, I don't want to say there was sort of sleep at the wheel, but I think they deliberately said, look, we sort of understand what you want to do, and we're just going to let you get out there and play. Now, in other markets, because of what's happened in Kenya, some of the regulators have moved in, and this happened in India. The RBI, very wisely, because if you think about the position of the emerging economy banks, now they've all stood up in this crisis we've had, and it's the Western financial system which has been creaking. But they're very heavily regulated, and in India the RBI said nobody but a bank can issue e-money, so network operators couldn't go forward with an M-Pesa-like product on their own. Now that regulatory context varies market by market, but we are seeing a shift towards, there is a realization that to push financial services out at low cost, you've got to move away from the old bank bricks and mortar and bank branches model. And so we are starting to see tiers of regulations appear which allow non-banks to enter. So there are opportunities in more markets, and that type of regulatory change doesn't happen quickly. That's one thing. Secondly, 4 years is actually quite a short time. There have been, history is full of sort of great ideas that take off quickly in one place, but it takes a long time for it to seep through and is picked up more commonly in other territories. And but even saying that, we're starting to see progress in Pakistan. There's a great outfit called Tamir have launched it's a combination of a network operator and a bank. A network operator bought a bank, and they've got about they've got over 1 million people using that system over there now. We've got 1.6 million people on a platform in Uganda, which is run by MTN. It's called Mobile Money. In Tanzania, and I was there last week, there are queues of people at agent locations now. These are the places where you go and put cash in and cash out of a mobile money system. That, you know, there's around 1.5 million people in Tanzania. There's schemes in West Africa, as organisations like Splash are driving forward. So it is happening. It's just not happening at the scale which everybody thought it would, given the success in Kenya. But it will come, and I think, you know, to Nathan's point, Nathan, you make a really good point. We need to be seeing that as a platform for lots of other services, and to be thinking about how we do that. But, you know, one of the frustrations really is that people are almost too eager, and the network operators around the world are quite, you know, we're a young industry, and we expect things to happen overnight. You know, look at the growth curves you showed earlier, Matt. People expect things to happen immediately, and it hasn't happened immediately. And so we've had this sort of disillusionment because we haven't seen more Kenyas in other places, but it will come, and there are lots of people working very hard to make that happen. But it's mobile banking per se has been talked about for 15 years, but it's only in emerging markets where we're going to see this sort of leapfrog to quite elegant, sophisticated solutions like M-Pesa, because of the customer needs. You know, the world we live in, you know, we have lots of ways to move money around. We've got credit cards and debit cards and ATMs, but actually you go to emerging markets, there's no infrastructure, people still want to move cash around, and it's really in emerging markets that I can see it, you know, the growth continuing. And then we could get some filter back into sort of the more mature economies. Great.
Thank you, Nick. Peters, one of the interesting things, you know, when we look at these adoption curves, it is easy to lose sight of the complexity behind those curves, and particularly when you talk about devices, right? And still, broadly speaking, in the developing world, they're very simple devices. SMS is obviously a major use. But you also see now smartphones emerging, particularly in the upper middle income countries, and those also will trickle down, and devices are getting much cheaper. So I'd be interested in your perspective on the importance of that trend in the developing world. Is the very simple Nokia phones that are mostly out there now, is that good for now, or will there be more possibilities, more value opened up as the cost of the more sophisticated devices come down? Does it matter?
Yeah. It definitely matters. I mean, if you look at a feature phone compared to a smartphone, a feature phone has about 5% of the storage capacity of a smartphone. It's got about 13% of the memory of a smartphone. So just the pure processing capability on the device is radically less overall. I think you're seeing a lot of movements to drive smartphone-based technology into lower-cost devices. So there's already smartphone devices that are sub-100, but you really got to get sub-50, sub-$25, right? And my belief is that will definitely probably come over the next couple of years. Most likely will come from the Chinese manufacturers who are looking to drive those solutions. So that will help. I think the other issue and the kind of challenge that you have is, so you can have a powerful device that's in there, but do you have the network to carry that in the developing areas? And you have actually the power to drive that device on a regular basis. You know, I came back from London last night, and I was having breakfast with somebody from Telefonica, and he was saying in Brazil, they can quantify if people unplugging the refrigerators for 2 hours to plug in their mobile devices, right? So they can get access, right? So the opportunity is definitely there, and they're using their mobile device as their sole communication process. There is no television in some of these villages and in those homes. There's no broadband internet overall. So that's the communication bit of it all. I think the challenge is going to be, though, is a bit of, particularly from the technology perspective, everyone gets caught up in the latest and greatest technology and wants to innovate in those areas. And for the markets that we talk about, you're talking about non-sexy type of technologies that are actually going to be extraordinarily effective. So when you talk about, and again, I'll be admitting this again with Nick. When Nick first came into my office talking about payments over SMS, I'm like, oh, that's, you know, what's so great and interesting about that? It's a lot of it's very, very counterintuitive to you and what you can use. Again, similarly, it was again a bit counterintuitive to me. I ran into a colleague in London a couple of days ago, and we're talking about the disaster in Japan and what the key learnings and all this. And he was saying, and he comes from one of the 3 operators, is he's teaching his family how to use Twitter. And I go, that's kind of interesting and odd. And I said, why is that? He goes, because the because of the power and disruption and the network issues that are still going on, because they're still having magnitude 4 and 5 earthquakes every day. Using the SMS channel for that network is a great means for them to communicate, right? So you don't have to have that constant application on in those areas. So if you talk in a broad sense, I absolutely am a big believer in mobile payments and solutions. I completely resonate with kind of Nick's comments. Is the things that are going to inhibit mobile payments are the traditional infrastructure, the brick and mortar systems that now want to take chunks of that. And again, I remember looking at that is when you bring in the banks, you bring in the governments, quite frankly, you bring in other companies, you know, Matt, where your heritage kind of comes from, everyone wants bits and slivers of that, right? And it's very, very difficult for you to make money in those areas and service those needs. So I think we need to really kind of focus those type of solutions, one. So it's what's the model and how does that work? And then two, it's, again, don't necessarily look for the latest and greatest technology. Look for simple solutions. I mean, I think there's amazingly innovative ideas that can be replicated. Everyone's looking for the latest and greatest. Again, in India, I was surprised by a guy who was saying, we're doing a weather app. And the weather app was giving agricultural information over an SMS. So I don't need the graph of the sun or the clouds. Quite frankly, who cares, right? Give me the temperature, give me the agriculture information, which I can get over 160 characters very, very easily. That's extraordinarily relevant to them. Or when they're going to be trading and things of the information of that nature. I think that's going to be important, and I think the ability then for them to distribute that application, right? How do people discover that and find that, I think is going to be another critical piece.
Great, thank you, Peters. You know, one of the interesting observations, and I guess, Nick, you were alluding to this, is because mobile is so ubiquitous in so many parts of the world, and because it is used for so many different applications, you're getting in this interesting environment where sometimes the more advanced mobile applications are actually not in the developed world, they're in the developing world. And mobile payments is a fine example of that. I mean, my goodness, I wish we had something in the US as simple to use as M-Pesa is in Kenya. Now, Erica, one of the interesting things about your organization is you not only do work in the developing world, you do work here. I mean, out in the Central Valley here in California. And I'd be interested in your perspectives about the similarities and differences of your work in the Central Valley in California with some of your work in the developing world.
Yeah.
And if there's any of this insight that goes sort of both ways.
I think there definitely is. I think that it's interesting because in the time that we've been in Uganda, we started there in 2007, between that time and now, the bandwidth has changed and the data speed has changed so much. So I've developed this incredible awe for how quickly technology changes, and I actually feel smartphones are going to be really critically important in health. Doesn't mean that everybody has to have them, but that's where you can do your blood testing and your reading of the blood test. And we heard about the glasses last night, which was just amazing. And there's so many smartphone applications that can improve health. And those are developing more quickly in the developing world than they are here. And the other thing that is because we have access to alternatives here. And the other thing that I think is going to come, I could be wrong, but I think cloud health and even cloud hospitals is going to happen first in the developing world. And that we're going to learn so much from that because we're so locked in here in the systems that we've already laid down. It's so thick. Like you've got your EMR system that you purchased, you don't have money to buy another one, and so you've got to dig through that if you're going to lay something on top of it, and you might get a little grant to buy a disease registry, and then it turns out that doesn't talk to your EMR system, so you're out of money and you can't do that. And so I think that's going to happen and develop and move faster, and we're going to learn how to get health out to populations through kind of cloud types of concepts there, and then bring that back here and begin to integrate it here. And I think that's going to be really exciting. I'm excited to see how that pans out, and so excited about the access. We've been to a lot of places where there might be primary care, but there's no tertiary care. And I think these types of systems are going to allow access to those higher levels of care and really give that quality of care and make that quality level care more accessible to everyone. And I think that's going to happen in the developing world first.
Thank you, Erica. Nathan, one of the interesting trends we also see is applications being built on top of really innovative applications, right? So once you have an M-Pesa there are a whole host of applications that can be built on top of that. Frontline SMS credit emerged from Frontline SMS, and I think it's a fabulous story. And I was wondering if you could share with us a little bit the story of Frontline SMS and their success, and how that has spawned initiatives such as yours and Frontline SMS credit.
So, Frontline SMS is a software application which enables a computer and a modem and a SIM card to become a communication tool for a grassroots organization that may not have internet access, but may be working with constituents or community members who have mobile phones, and to communicate with them via SMS and to manage, bulk SMS delivery and receipt, generally for text messages. I think the way that I think about it is enabling, when you have a population with mobile phones, enabling the organizations working with those populations to fully take advantage of the mobile revolution. So the two things that I think run throughout the efforts enabled by Frontline SMS, which has been taken into health, election monitoring, and of course now mobile payments and a range of other areas. One is the focus on SMS, which is lowest common denominator in a good way. If anyone with a phone can use this route to communicate, regardless of how expensive it is, what network they're on, pretty much anything else. It's the interoperability can't be matched, and I think the increasing penetration of smartphones will deliver a lot of exciting things for organizations that can use more bandwidth, but for the people who need the help most and have the fewest other resources to access them, 160 characters can be that lifeline. Second, we design our software around the conditions in organizations that don't have a lot of other technology tools being built for them. And in the way this plays out in the payment space is that we want to bring the capacity for mobile payments alongside the capacity for SMS communication into organizations that are already working with the poor. And there's obviously a phenomenal number of new initiatives that are building mobile applications and delivering functionality to organizations that are taking that technology to the poor. But distribution channels to reach remote populations are incredibly difficult and expensive to build. And oftentimes, the reason that they aren't being reached with services already is because institutions don't know how to work with the poor. And so I think banks and the lack of financial inclusion in many developing countries is a good example of that. So by starting with the organizations already working at the ground level, we think we can provide a piece of this that other technology approaches may not be able to provide.
Thank you. Nick, did you want to add to that?
Yeah, just make one point to sort of build on what Nathan's saying. I think it's reasonable to assume that let's take a 3 to sort of 5 year horizon, mobile payments itself will become commoditized in the same way sort of voice is now and data services are. I think every network operator and an awful lot of banks will offer mobile payments services as sort of base offering, and that will do a number of interesting things in the marketplace. It'll start to drive down the transaction cost for the consumer because there'll no longer be a differentiating point for an individual mobile service provider in a market. And it will turn the focus to, well, what is it that mobile payments then enables? And I think that's where this is sort of, that's where the higher margins will shift to. And I think we'll see even more work being put into thinking about, well, now we can move a small amount of money around at very low cost in any market and on any network, and that even will be interoperable, because that's how network operators exist in our ecosystem. Everything interoperates. Interoperations will come in payments, prices will come down, and I think then we'll start to see this plethora of value-added services about now we can use that payment service for something else. And I think it's the something else that Signal Point's interested in. It's thinking, 3-5 years away from now, what other doors are going to be opened if we can do small transactions at low cost in emerging markets?
Thank you. And I want to open it up just a little bit here and ask a question, and any of the panelists here are welcome to respond. One of the interesting things that we see is there are a lot of great anecdotes, there are a lot of great stories about the ways in which various mobile applications are changing the lives of the poor. Sometimes, however, it's hard to distinguish between an anecdote and a real scalable solution, right? An application that's not just meeting the needs of 10 people or 50 people or 1,000 people, but rather of hundreds of thousands or millions of people. I'd be interested in the panelists' perspective on whether there are a lot of solutions that are actually having impact at scale, and what are the determinants of whether a solution can actually have that impact at scale. So I open that to any of you who would like to weigh in.
Yeah, I'll chip in. As I said, I think the biggest challenge is just that point. We need proof points of scale, and that means a number of things happening. And I know the work that Peters is doing in WAC is great, because you need the industry to move on some things. So we need common standards, we need common APIs, we need protocols, and that work can be done at the industry level. And I think that's why organisations like WAC have got such an important role to play. But we do also need, somebody needs to take the first step out and take some risk, I think that bit still needs fixing. We've got to find people that can see where this can go, but we'll be willing to step in at this early market stage and try and drive that sort of innovation, which eventually will lead towards some of the industry moving there as well. So it's how do we get that pioneering stuff done in a way that is scalable? So simple propositions, focusing on consumer, keeping the costs low, thinking about basic issues like distribution. I mean, M-Pesa only works really well because we've got 22,000 places around Kenya where someone can go with cash, put cash in and turn it into electronic money. So we've got to think as an industry, what are the bits we can use that will drive scale? So distribution, low costs, making it work on all handsets, locking into technology standards. These are the things that need to be thought about now for us to be able to see scale in the next couple of years in some of these applications. Yeah.
Erica, you want to?
Well, I was going to say, I agree, and I would also add just that we need to be able to get good data back on what's working and what's not, and be able to make those comparisons, and we're so hopeful that there can be innovation and support for private technologies enough so that there's development and innovation, but not so much so that we can't afford to be interoperable and to allow programs to move up to the next level of technology. And I also wanted to mention, I meant to mention this early since it affects what you're doing, is that though the US system is locked in and may not move as quickly to mobile health solutions as I think the developing world will, there are some lessons learned in the US that are so transferable backwards, one of which is because of the legal setting in the US, protocols have been developed that are excellent and can be used in settings like Nick is developing, where we already know how to treat something almost up until the emergency room door without actually having somebody have to go to the emergency room. And so those kinds of things can be transferred back. And also the privacy things that have been developed because of the HIPAA laws, HIPAA boxes or ways to privatize can also be integrated, which are going to be so critical in I think money and in health, and so those do feed backwards too. But I think we need to be able to compare with the standard, the gold standard, and see what's working and what's not. And you can only do that if you can get good data, even in a small system.
Just quickly, I would say, to your opening question, quite frankly, other than M-Pesa, it's hard for me to think of something that's reached kind of that magnitude and scale. And I think, again, for a couple of reasons that have been talked about, it's very difficult to develop on their different platforms, one. It's very difficult for people to figure out, how am I going to fund this? So if you think about, let's think about, in the US and OECD countries, kind of the iPhone, Google model, right? And there's a lot of innovation that's going on in the developer community. But in the same vein, there's very similarities, right? A lot of these guys are coming out with all these applications trying to figure out how are they going to monetize this? How are they going to make this? How are they going to sustain it? Which is actually kind of a microcosm that we're dealing here. So part of that is we got to find low-cost development environments. We got to find how do we find some seed capital that gives the attention. And I think what Erica's saying is you got to think about how a reverse strategy of what developing countries can innovate that has applications in OECD ones. I think that is really untapped. You know, putting on my Vodafone Americas Foundation, Netra was a good example with the eyeglass ones that we saw. One of our early ones was this guy, Daniel Fletcher from UC Berkeley, who was doing a microscope for the mobile phone, right? And his whole notion was doing malaria testing, where he's saying you could do it at that level. But he also had an eye to, well, it has an OECD-based application. In fact, he's just started a company for ear infection testing, right? So it's having the real clear innovation capabilities to sit there going, I can solve a direct problem in a developing country, but I can figure out how I'm going to finance that through OECD-based countries, developed countries, things of that nature. I think that is what's going to help enormously to kind of spur on innovation.
Great.
Well, I don't have a question, an answer to your question, Matt, but I can say that that's a really important point for people, particularly I think on the philanthropic side of things, to be very cognizant of, that there are a lot of anecdotes and fewer success stories at scale. And in particular, I hear and I see in stories written about M-Pesa really exciting anecdotes of pilots, but they are really just pilots, and they're reaching 20, 40, 60, 100 people. The only service delivered through M-Pesa that I've seen outside of financial services that's reached some sort of scale or reached systemic use is using M-Pesa to pay for water bills in Nairobi, which is great and really convenient, but by definition, if you've got running water and with the utility in Nairobi, that's not the population that most of the organizations here are looking to reach most of the time. So pay a lot of attention to how many people are being served by the exciting examples that you hear about.
Thank you. I want to continue this a little bit and introduce the idea of the profit motive into this discussion, right? Because we're talking about innovations that serve the poor. And a lot of times people get into pretty heated discussions when you talk about the profit motive and the poor. And I'd like to get your perspectives around, as we think about scale, how should we think about the role of the social sector, the not-for-profit sector, and how should we think about the role of the private sector? What kinds of roles might each of those play? And specifically, in order to get to scale, do you need a private market? Or are there things that you can do with philanthropic capital that can get ideas to scale?
Yeah, well, I'll kick it off. Somebody needs to start the testing process off. Now, if you're a chief financial officer in a network operator, and those growth curves that you showed earlier, Matt, are still in front of you, someone comes in and says, where are we going to put our investment dollars? That CFO will make one call every time. I'm just going to put up more network. I'm going to acquire more customers. And whilst they're in this growth phase, network operators aren't going to start thinking about the more complex value-added services that are sort of out there, because it's not what they're incentivized to do. They're incentivized to get a return on investment as quickly as possible. And in a high growth market, they're just going to do core business. Mm-hmm. So that's a challenge, actually. So that's why I was saying earlier, what we need to do is start incubating and testing out some of these models outside of the core mainstream network operators business. And that I think is a very important role for philanthropists that can see the vision here and be willing to put some money on the table to drive through some potential opportunities. They will only come by getting out there, rolling your sleeves up, and getting on with it. And we could sit in rooms and prepare PowerPoint slides on what a mobile service might look like in an emerging market. But until you actually get out there, put that product in the hands of customers and watch what they do with it, you'll really understand what it is they like, what they don't like, how much they're willing to pay for it, what are the risks in trying to grow that in a low-cost, efficient way. So I think it's about finding sources of funding which are willing to say, okay, I buy the mobile health vision. Here's some money on the table, just go out and work out what works and what doesn't work, but keep your focus on what customers, how the customers respond to offers that you're putting in front of them, and that's really important. Now the basic economics in emerging markets, it's all about scale. If you think, your profit is your, whatever you can sell a service for minus your costs, times the number of times you can do it, multiply it by the number of points you can sell it at. We've got an opportunity with mobile services to deliver things at very low cost, and we can hit the scale. So I do believe that there is a profit opportunity in this equation. And M-Pesa demonstrates that. As long as you can get past that critical volume, the network effect starts to kick in, and you've got scale, low value transactions in huge numbers, and that sort of drives the, makes it sustainable business in economic terms.
Yeah, I completely agree with Nick. You talked to the Vodafone CTO, and we talked about India. His fourth variable cost is diesel, right? Because he's got to ship diesel to keep the base stations up and running, because he doesn't have continuous power overall. Quite frankly, on their agenda right now, if not these apps and driving those solutions, they're trying to build up kind of core services and make those things happen. So I'm not sure that's going to enable it. I think obviously, as we talked about earlier, a developed or OEC-based solution that's being kind of subsidizing, if you will, the developing one's model. That's one model. Obviously, I think Untapped and has opportunities is looking at advertising, what can be done in that area and how you'd reach those markets. I think the third one, which again is a bit intriguing, is one of our members is Telefonica, and Telefonica has this system called Bluvia. And what Bluvia does is they do a revenue share for voice and SMS minutes. So if you think about a cost subsidies in those areas, you come up with a clever app, I will give you a portion of my SMS revenues and my voice minutes revenues as well, right? And those are, I think, ideas that can help kind of self-fund and drive those solutions. But getting that initial seed capital is still going to be a challenge. Yeah.
I think there's a special role for microeconomic development around health solutions in actually creating sustainability. I actually think that if we can develop systems wherein community health workers are getting paid for providing a service, not only does that help deal with some of the poverty issues, but it also roots the knowledge around that health issue in that person and in the community, thereby in the community. So, issues that are dropped onto a community from an outside nonprofit may not sink in, but if people are bringing, say it's a blood test for malaria, or we're talking about malaria, so we'll stick with malaria, a blood test for malaria out with a mobile unit to a villager, testing, and then hopefully along with that also giving some information about the results of that test, because we do see some of those issues, like 23andMe just got, the government's been talking about that not happening here. We get information but know about a test, but aren't dealing with that information. So I do think that information needs to be then dealt with. There needs to be some education around it, but still that roots that health understanding in the population in a way that otherwise may not happen. So I think it's really exciting thought for really rooting health change and improving health.
So the question that I wrestle with a bit and goes back to what Peter said about monetization strategy of companies in developed markets is that it's tough at the base of the pyramid to price your product for your first customer so they can buy it and not run out of money before you reach your 10,000th customer and reach scale and profitability given how much it can cost to reach each person. And I've seen a lot of business models and business plans that look at that top line mobile penetration number and say we just need to reach the kind of viral distribution that you can get with a web app or web service in the US or something, and then we'll be making money at the base of the pyramid. And what I'm finding is that I think it's going to take a little while to figure out how much money can be made and what the cost of distribution is. And once that settles out, what the real potential is and the business model and revenue streams that make the most sense for an organization trying to do what we're doing. And so what I would say is that just suggest that the audience here think about your openness to having grants that may seed for-profit approaches, and to view that as a positive development, and to get good at structuring entities that can then carry out that for-profit approach and have the benefits and revenue from that flow back into the nonprofit mission that you started with. There are relatively few organizations with that strategy, and I think it's something that's very needed across a lot of sectors at the base of the pyramid.
And if I can just pick up on that last point, at Omidyar Network, we are deeply engaged in the mobile space, and we actually do invest both on a not-for-profit and a for-profit basis. We think it's actually very exciting to see those opportunities where you can use grant capital to spur and nurture markets, and then for-profit capital to actually help take those to scale. So I think sometimes we get in this bifurcated mentality where it's all about grants, or it's all about for-profit investments. And it becomes a philosophical debate, and people begin to shout at each other around these sorts of issues. The reality, in our view, is that sometimes you need more of a blended approach. Sometimes, actually, you need to provide grant capital, subsidized capital, to begin to nurture a market. But the real point at which you get scale is when you can actually create a commercial enterprise that delivers value to your users. So I just offer that up as a way we think about it anyway. I want to ask one last question of the panel, and then I want to open it up to Q&A. In my view, there's actually no question that the rapid adoption of mobile telephony around the world has improved the lives of hundreds of millions of people. And from an economic development perspective, The Economist, I think, has estimated that every 10% increase in penetration of mobile telephony results in a 0.8% increase in GDP. It's almost a full percentage point greater in annual GDP because of broader mobile penetration. But is there a risk here? I asked the panel, is there a risk here that mobile becomes overhyped? That we see it as the cure-all for a lot of the ills that still plague much of the world? And somehow, in getting caught up in this hype, do we forget a lot of the other hard work that needs to be done and creating opportunity for hundreds of millions around the world? So undoubtedly, mobile is an incredibly positive development, but what's the risk of overhyping it, and how might that play out? Is there a risk?
Yeah, I think we've sort of seen that with M-Pesa and the frustration that we haven't seen multiple M-Pesas at that scale in other markets. So yeah, there is, human nature is to sort of get quickly into a product which looks exciting, and you get one proof point and then assume we're going to find lots of those. And I think that's something we've got to deal with, as a sector, and realize it is actually really hard work to make these things stick at scale in other places. So I think just to bring it all back to what's relevant for the consumers in these marketplaces. We're focusing on things like savings, which is now known. Lots of people on low income do all sorts of things to try and find ways to save money. We can offer them new services with mobile. Health, I think there's this huge untapped need, and we can reach people in ways which have previously been too expensive and too difficult to do using mobile channels. And we can start to break down other barriers, but it's not the panacea. There's still an awful lot of work to be done around the basics of making that viable. So it is distribution, it is sales, it is understanding at what points customers are willing to pay for things. And we also need other stakeholders. We need regulators to sort of allow new models to appear in the marketplace. We need to sort of risk adjust everything around health services. We shouldn't be applying Western world controls to services delivered in emerging markets. That's patently true in the financial space. If you're moving around a small amount of money, you don't need to apply the controls around financial transfers that we see in our communities. So so it is difficult. There's lots to do, but I think the fundamentals are in place, and that point of connectivity with millions of people now via phones, which we've never been able to do before, is much more of an opportunity than some of the risks involved.